Good morning, sir. May I know your name?
My name is Vecklye.
Alright. Good morning, Mr. Vecklye. My name is Adrian Vecklye. I am a nurse in charge for this health education. I have been told by the doctor that you have a current illness which is called emphysema. So today I'm going to teach you about emphysema and introducing you a correct way in using a metered-dose inhaler. Okay, so do you know what is emphysema means?
No, I know nothing about emphysema.
Alright, it's okay. I will tell you the meaning of emphysema. So, emphysema is a chronic lung disease, which means it develops slowly and lasts for a long time. It falls under a group of lung disorders called chronic obstructive pulmonary disease, or COPD. Emphysema damages the tiny air sacs in the lung, which is called alveoli. These air sacs normally help move oxygen into the blood and release carbon dioxide in the body. But in this case, which is called emphysema, the wall of the air sacs become weak and break down. As a result, there are fewer air sacs and less surface area for oxygen and carbon dioxide to be exchanged. So the body gets less oxygen and it becomes harder to breathe, especially during physical activity, because the damaged air sacs cannot keep up with the body's oxygen needs.
Oh, I see. So what is the causes of my disease?
Alright, so one of the most common disease for emphysema is smoking, because cigarette smoke contains harmful chemicals that damage tiny air sacs in the lung. This causes the walls of the lungs destroyed and weakens their ability to transfer oxygen and carbon dioxide efficiently. Other than that, prolonged exposure to airborne irritants such as breathing in air pollution, smoke from industrials, or chemical fumes over a long period of time can irritate and harm the lungs alveolus. Other than that, because of genetic factors such as alpha-1 antitrypsin deficiency, some people are born with this deficiency. Without this, the body's own components can attack and damage the lungs tissue, causing emphysema at a younger age, even the person has never smoked. And also other factors such as age and infections. This disease develops slowly and predominantly in older people, reflecting years of damage. Frequent respiratory infections such as bronchitis or pneumonia also may contribute to the weakening of lung structures over time.
Oh, I see. So how do we know that we have emphysema?
So there are lots of signs and symptoms, but I can give you the common ones. So one of it is the shortness of breath, because the damaged air sacs can't efficiently transfer oxygen into the blood, making it harder to breathe, especially when you do some physical activities. Other than that, you have a chronic productive or non-productive cough, because some people may produce phlegm, while others just may have a persistent dry cough. Then you will have wheezing, and you will have fatigue and weaknesses, and weight loss also. Your appearance will have a barrel chest, which when hyperinflation occurs, when air gets trapped in the lung, causing the chest to become round and expanded. And last but not least, you will have a pursed lips breathing. This is a physical adaptation people use to keep the airways open and release trapped air. So that is all that you can know and recognize the signs and symptoms of the common emphysema. Do you have any questions?
No questions. I understand it well.
Alright, that's great. So, do you know how to prevent or reduce emphysema progression?
No, I don't know.
Alright, it's okay. Let me tell you. One of the steps to reduce emphysema progression is to stop smoking. And then we need to avoid lung irritants, get vaccination to prevent lung infections. We need to use medications properly and eat a healthy diet. You can also visit your healthcare provider regularly to know your health status, and you can join pulmonary rehabilitations when you have free times. Now, I would like to teach you on how to use a meter dose inhaler correctly. So this is a meter dose inhaler. I brought these two, one for me and one for you. And you please hold it, and you see it and feel the device. Okay, so do you know what's the purpose of meter dose inhaler?
No, but can you tell me?
Alright, sure. So, a meter dose inhaler, or you can say inhaler for common names, is a device that delivers a specific measured dose of medications directly to the lungs. And this medication and this inhaler is used for people with chronic lung conditions, such as you, who has emphysema, asthma, and COPD. I'm going to tell you the types of medication used in inhalers. So the first one is the inhaled corticosteroids, such as Pulmicort and Flovert. The second one is short-acting bronchodilators, which is albuterol and ipratropium. Albuterol, also known as Vecklye, and ipratropium, such as Adrian. The third one is long-acting bronchodilators, such as Spirivan and Cerevan. And last but not least, the combination of different types of medications. We already know the medications. Do you know the side effects of the medication used?
No, I don't know the side effects.
Alright, I will tell you about the side effects of the medications. Commonly, when you use this medication in this inhaler, you probably can get fungal infection of the mouth when you use, and then you will get hoarseness, headaches, tremors, especially you can see visibly on your hands, and then your heart rate will increase. And last but not least, you will have a reflex in cough or tracheal spasms. So, before we move on to the next session, the doctors ordered me to administer a prescribed medication in this inhaler, which is Vecklye. So, let me ask you something. What type of medication for this Vecklye?
Vecklye is a short-acting bronchodilator.
Yes, it is correct. Vecklye is a short-acting bronchodilator. Now, I'm going to teach you how to use a meter dose inhaler correctly so that you can use it without any assistance. So, step 1, remove the mouthpiece cap from the inhaler like this. The mouthpiece inhaler can be put aside. Then, hold the inhaler with index and middle finger at the top and tongue near the mouthpiece. Then, shape the inhaler well like this. Step 4, you can stand up or sit up straight. Then, step 5, tilt the head back slightly and breathe in and out fully about 2 times, like this. 1, 2. Okay. Then, step 6, seal the lips tightly around the mouthpiece of the canister at the end of the second exhalation, like this. When you put your mouth on the mouthpiece, it must be at the second exhalation, like this. Do you understand?
Yes, I understand.
And then, step 7, depress the medication canister once like this. Once the inhaling slowly and deeply through the mouth. Like this. When you press, you need to deeply and slowly. Then, step 8, you need to hold your breath till the count of 10, if possible. 9, exhale through the pursed lips like this. And then, last but not least, if the doctor prescribes you more than 2 puffs, then you need to wait for 1 minute and repeat step 4 to 9. But in this case, the doctor only prescribed you 1 puff only. So, do you have any questions regarding the steps that I already explained to you?
No questions for now.
Alright, that's good. Now, I want you to do a written demo for me. Is that okay?
Yes, sure.
Okay. Okay, we are already at the end of this session. So, do you have any questions about the inhaler?
Actually, I have a question. What if my medication is run out? Should I throw it away or buy a new one?
Okay, so that is a good question, mister. So, when your medication run out or finish, first thing you need to do is you need to go to the nearest clinic or hospital, and then you need to tell the healthcare provider about this issue. The healthcare provider then will give you a new set of canister medication based on what the doctor prescribed. You can remove it and put a new set of canister medication. The body, however, should not be thrown away into the dustbin as it can be used multiple times. Remember, you need to keep it hygiene. You need to keep it clean so that it will not cause any fungal infections, especially to your mouth. Am I clear about this?
Yes, clear, I understand.
Alright, thank you. Before we end our session, I have already prepared a pamphlet about emphysema, about what we already learned just now about signs, symptoms, the causes, how to reduce or prevent, and of course, the correct ways to use a metered dose inhaler. You can see for yourself. You can take a look a little bit. So, you can see this is the condition for emphysema, the normal alveoli versus the damaged alveoli. You can see the normal alveoli and the alveoli with the emphysema. Since we are at the end of the health education session, I would like to ask you a few questions to know your progress on the knowledge of emphysema. So, the first question is, what are the signs and symptoms of the emphysema?
The signs and symptoms could be shortness of breath, wheezing, and also weight loss.
Is that it that you know?
That's all I can catch up.
Alright, thank you. It is all correct answers. My next question is, how do we manage the progress of emphysema?
To manage the progress of emphysema, I need to stop smoking, and also I should avoid lung irritants, And lastly, I need to use my medications properly.
Alright, that is the correct answers. Alright, I would like to ask a few questions about the knowledge of meter dose inhaler. So, number one is, what is an inhaler?
Inhaler is a device that delivers a specific measured dose of medication so that it can go directly to the lungs.
Okay, so next question is, what are the benefits in using inhaler?
The benefits of using inhaler is it can deliver the medications directly to the lungs. And next is it can manage the symptoms of chronic lung diseases.
Alright, so my final question is, what are the side effects when using medications from the inhaler?
The side effects of medications could be headache, tremors, and also increased heart rate.
Alright, that is a correct answers. Thank you, sir, for your cooperation. I hope that my health education can help you to reduce or manage your complication of your disease.